Hello, my name is Linda Curran. I'm a trauma therapist, a trainer, and a consultant. I'd like to introduce you to the program. The program began as an attempt to bridge the gap between substance abuse and mental health treatment. I never really understood this split. We know that trauma and addiction are 80% correlated, so it really didn't make too much sense to me. As I began the research phase of the project, I realized that we had additional problems. The first thing I discovered is that substance abuse is not substance dependent, but experience dependent. And those experiences, those adverse childhood experiences, have been studied now for well over 2 decades. The problem is we really haven't integrated it into clinical practice. The second thing I discovered is that there's a serious lack of understanding about the term evidence-based treatment. Although the APA put out a statement in 2005, most clinicians still remain confused by the term. But the most egregious and pervasive really is the misconception about what constitutes treatment versus what constitutes support. This is not a problem that's exclusive to substance abuse counseling or addiction medicine. This is systemic across fields. We have a legal system that has probation officers, parole officers, and judges who mandate treatment for people. We have a medical system where nurse practitioners, doctors, even psychiatrists refer their patients to treatment, as well as policymakers and just about any man or woman that you would ask on the street who consider a 12-step program to be not only the treatment of choice, but the only treatment. And this is harmful in so many ways. This program attempts to clear up those misconceptions and to bridge the gap between research and clinical practice. Although I wish I could disperse this knowledge across all systems, this particular program is geared towards clinicians. It's divided into 3 parts. The first is to explicate the problem. The second is to present the research on developmental trauma as well as addiction. And the third is to introduce trauma-informed clinical practices. To do that, I'd like to introduce you to the experts in the field of addiction, developmental trauma and attachment, complex trauma, and neuroscience. Please welcome the master clinicians. Dr. Lance Dotis and Dr. Gabor Mate, both psychiatrists and specialists in the fields of addiction. Dr. Bessel Kolk, psychiatrist and expert in the fields of developmental trauma, attachment, and complex trauma. Clinicians and trainers in the field of complex trauma, Dr. Christine Courtois, Lisa Ferenc, Dr. Mary Lou Shack. Dr. Lane Peterson, Dr. Lou Cozzolino, and Dr. Jim Hopper, neuroscientists, researchers, and clinicians, and Dr. Vincent Felitti, physician, researcher, and co-principal investigator in the now famous Adverse Childhood Experiences study.